Hi, thank you very much for that introduction and for your warm welcome. I know in England it's a horrible day today with the rain is absolutely pouring down and we've had gale force winds. So actually to spend time in that kind of glow thinking about breastfeeding is a pleasure and a lovely way to end the day. I've spent most of the day cuddling my granddaughter who's off nursery with a cough and a cold. So excuse me if my voice keeps going occasionally because she's been sharing. So I have a lot of questions over the years about migraine and breastfeeding. Most of them that start with, can you help me to stop breastfeeding? Because I need to be able to treat my migraines, and I'm told that I can't do both. So, how did I get to this place at this advanced age of being able to give up work and follow my dreams? Well, more years ago than I'm going to admit, I was actually born over a Boots pharmacy when they gave managers a flats over the top to enable them to go and dispense prescriptions or sell medicines at any time of the day, 7 days a week. Um, so I kind of got used to the idea that pharmacists were part of the community and a very valued part of the community. So there was never any doubt that I was going to be anything other than a community pharmacist. Well, my children were growing up. I was a stay-at-home mum, but I worked sometimes for 2 weeks at a block when my mum came to look after the children, or I worked Saturdays when dad took over. But I became more and more interested in the use of medication and breastfeeding, partly because I myself have Crohn's disease, which needs lots of medication. And I realized that the time when I was healthiest was when I was pregnant or breastfeeding. Now, having limitless children and breastfeeding the neighbour's cat, I decided wasn't an option in the end, although all my children were breastfed long term. But I qualified as a breastfeeding counsellor with the National Childbirth Trust when my youngest daughter, well, I was actually in hospital with high blood pressure just before she was born. And during my training, I went to a workshop and somebody said, why can't you put the breastfeeding and the medication interest together and develop some specialist data for us? And we have a leaflet that is 2 A4 pages, and we'd like you to cover some more information. I then kind of went away and I worked for 2 weeks in a pharmacy, which was a homeopathic pharmacy, and nobody wanted to talk to me. And I knew nothing whatsoever about homeopathy. So I had little to do for this fortnight, and I ended up writing some 40 A4 pages, just using the BNF and my knowledge about, as a pharmacist, about how drugs passed into breast milk. That never felt enough, so I went away and started a PhD looking at the experiences of mothers, GPs, and pharmacists in a matched area. And I was lucky enough to be able to graduate in the same month as my eldest daughter. So, not very often do you have pictures, as in the top one, of mum and daughter graduating together. But the PhD enabled me to go away and write some books, which was probably, I had this idea that it was going to cure everything and nobody would ever be told to stop breastfeeding in order to take medication again. No, still not happening. But I was absolutely gobsmacked to have the letter in December 2018 saying that I'd been awarded an MBE, because I thought, I'm just an ordinary person. I'm nothing special. I'm just following my passion. But to be able to go to Windsor Castle and receive that award from Her late Majesty the Queen was something beyond my wildest dreams. And that's why I've never really been able to put the subject down. When I handed over the drug line to the rest of the breastfeeding network, there were 11 pharmacists. There are another tranche of 12 further pharmacists. So there's 24 people now answering the queries. So lots and lots of people there to help. I'm still working on possibly what is going to be the last book, because it's proving quite a large topic. So what do I want to cover today? I want to look about the relationships between breastfeeding and migraines, to do a brief, but I promise really simple talk about how drugs get into breast milk, and then look at how the drugs which are used to treat and prevent migraine can be used during breastfeeding, and why sometimes breastfeeding is seen as a barrier for mothers who are having migraines. So I asked some mothers during my writing of my books to send me their experiences. And this one mum said, I battled with breastfeeding my two sons over a period of 5 years through chronic migraines, spent many a tearful hour on the phone checking my medicines would be okay to take and weighing up all the facts. It was hard work and stress because none of the medicines are tested in this country, and you feel that you are constantly swinging between guilt and chronic pain. And that's a really sad position to be in, and something I hope that none of you have had to go through. But I suspect actually there are a good few who have. So when we say that drugs aren't tested, when a new drug is launched onto the market, the manufacturers don't have to conduct any clinical trials because nobody would want to expose their newborn baby to a drug, and when we don't know anything about it. But over time, we may study a group of mothers, or we might test their milk and discover how much gets through, or we use our knowledge of how drugs pass into breast milk to evaluate the safety. There are many triggers for breastfeeding, and I'm sure you'd all agree that actually one of the biggest triggers is lack of sleep, um, which goes with being a mum. They don't sleep through the night at 6 weeks, 8 weeks, 6 months, 6 years. Um, and you've got that broken sleep cycle. And when you have a young baby, it's often really difficult to find time to eat and eat properly. So you might pick up a sugary snack, you might drink a cup of coffee in order just to survive the fatigue of being a new mum. And all of these can be triggers for migraines. So migraines affect 1 in 7 people. And when I was writing the book about chronic diseases, the thing that struck me most was every one of the common conditions, women are more affected than men. And I have no idea why that is so. But a lot of the autoimmune diseases are like this, where 1 in 3 women may have migraines, and much less frequent in men. Is it because we admit it? Is it because we work 10 times harder because we're multitasking everything else that's going on in our lives? We might have a period of grace where the frequency of migraines reduces in the second, third trimesters, and we're thinking, okay, this is fine. Maybe I've grown out. Maybe my hormones have sorted out. But they can reoccur after the birth, particularly where those people have predominantly premenstrual symptoms. So I actually had an email this week from a mum who was very anxious that although her migraines had ceased during pregnancy, she knew they were always linked with her periods, and would they be linked with the hormone changes immediately after birth? And that she would need to take a triptan every 12 hours for 48 hours in order to get past her migraines. And was this going to be okay for her new baby? But the only thing that we can say is that I've actually never had anybody reporting migraines at that stage and that severely. And I think that the triggers may be related to different things other than the surges in progesterone and prolactin and the lowered estrogen levels immediately after birth. The one thing lots of people don't understand that we can actually cause medicine headaches by taking too many remedies on too frequent occasions. So if you're taking paracetamol and something like ibuprofen or any of the other non-steroidal drugs on more than 15 days a month, you may actually be causing your migraines. Or if you're taking your triptans or opioids on more than 10 days a month, again, you may be triggering the headache rather than curing it. On the differences in overuse headaches, there's a dull, constant headache present on most days or a part of every day. And the only answer is to stop taking all of the medication, go through this sort of clear out period, and then start again. But when you start again, maybe it'd be useful to think about how you could prevent migraines by your lifestyle changes, look at your triggers, or look at using drugs to prevent the migraines rather than treating them each time. And I have shared this information with quite a few people. I've never actually had any feedback from anybody who said, wow, that makes total sense. I need to go through it, because I think it must be hell on earth to go through that pain and not be able to take anything. So how do drugs pass into breast milk? And why do so many professionals say you can't have a drug if you're breastfeeding? And it's because most of us didn't have any training on breastfeeding or how drugs pass into breast milk in our undergraduate training. It's changing very slowly now, but only in the last maybe 5 years. And that's quite weird, because the only way you can then get the information is by being a parent yourself, or perhaps having a mentor who's a parent who understands these things. And I've been involved with lots of doctors over the years who said, I just didn't get it till I was a mum or I was a dad. And how important breastfeeding becomes to you, particularly if you've had to struggle to get breastfeeding established. And we know that breastfeeding isn't always easy. The lack of support around in the early few months isn't always there. But all of us as professionals are frightened of being sued. And in the back of our heads, there is the stories of thalidomide, and how when mothers took a drug that had been deemed as so safe that it was sold over the counter for morning sickness, these babies were damaged, had loss of limbs, had so many problems internally and externally, and many of them didn't survive. And we're really scared that by prescribing a drug during breastfeeding, we might risk something like this. Because we often talk about pregnancy and breastfeeding in one breath, when in actual fact, they're totally different. When you're pregnant, the baby's organs are developing, its major blood vessels are developing. By the time it's born, it's all there, it's complete, but it's then its own liver and kidneys have to deal with the drugs that pass through breast milk. But the breast is actually a much better filter of drugs, and most of the side effects are really quite short-lived. So I'm sure many of you who've been breastfeeding will have noticed that if you have antibiotics, your baby gets diarrhea. If you take something that makes you drowsy, your baby can become drowsy. But the leaflets in all packages say, don't take this if you're breastfeeding, or consult a pharmacist or doctor before taking it if you're breastfeeding. And that's just because the manufacturers aren't required to take responsibility, and they go back and say, we didn't do any trials. But when it still says it on things like ibuprofen, which we have a mass of research data, it seems that we're still in a retrograde step of not providing evidence for mothers to make their own informed decisions. The information is there. There are maybe 3 drugs that say you can use if you're breastfeeding. And one of those is a biological drug, which says you can use it if you're pregnant or breastfeeding. And I applaud the company for doing that. For migraines, the only drug I can think of that you can't take is ergotamine, which had the brand name Migril, but I don't believe is any longer made. It was one my mum used to take because she suffered very badly from migraines. So the science bit, but I promise you it's not that difficult. So most drugs have to pass through cell membranes to get into milk, but that is except in the first 3 days after birth. I have a slide which explains this a bit more in a moment. And you also have proteins in your blood which the drugs bind onto. And the more the drug is bound to the proteins in your blood, the less is free to pass through the membranes into your milk. We also need to consider the half-life of the drug, which is how long the drug stays in your system. Is it like flucloxacillin, where you need to take it 4 times a day, compared with another drug that you only take once a day? So the longer the half-life, the more it could potentially build up in your system. But drugs aren't stuck in milk. And as the level in your body lowers, the drug comes back out again. Do you remember in your kind of sixth form science days of having a membrane in a bell jar usually and putting a coloured dye in one side and then watching the dye pass across the membrane until it looked the same colour on both sides? That's exactly what happens with the drug and the breast milk. When it's at a higher level in the mum's system, it can pass across in breast milk. But as the level in the first side comes down, it gets sucked back out again. So you never have to pump your milk to clear it of the drug. It's coming back out of its own accord. But the most important thing is that some drugs are so big that they can't be absorbed from milk. And these are drugs which are given only by an injection because there's no oral form available. So I'll explain these in a bit more detail. So in these first few days after birth, the gaps between the alveolar cells are wide in order to pass all the magnificent immunoglobulins in to protect the baby, to line the baby's stomach, and to protect it from gastric infections. But it means that any drug that we give in there just goes straight into breast milk. But when is the time we probably give the most drugs to a breastfeeding mum? In that first 48 hours. We might have given them a cesarean section, so we're giving them stronger painkillers. They might need antibiotics, they might need a laxative. Excuse me. All the different things that could be given. But we're not so scared of those because this is custom and practice, something that we're used to doing all of the time. We know that the value of the breast milk is high. And actually, the volume of milk that the mother is making as colostrum is very, very small. So the absolute amount of drug that's passing through is very small. I hope that makes sense. If it doesn't, please shout and I'll explain it again at the end. But as the mature milk comes in, these cells close up so that drugs have to go across the cellular membranes to get into breast milk. And these are really complicated cell membranes, which don't let things grow through easily. They have to have a particular pH. They have to be more fat soluble. The breast is being this brilliant filter of stopping everything getting through as much as it can. The half-life of the drug is the time when the amount that you are taking decreases in your body by 1/2. After 2 half-lives, you've got a quarter. After 3 half-lives, you've got an eighth, and so on, down to 5 half-lives when it's regarded as the amount in milk is negligible. So sometimes if a drug isn't compatible, we might have to say you need to wait 5 half-lives until the drug has gone. But if the half-life of the drug is more than 24 hours, at the end of 24 hours, let's say we have 80% left, but then we give another 100% of the drug, so we've got 180% of the drug. After 2 half-lives, we've got 80%, 60%, and we give another 100%. So can you see how that starts to escalate? And one of the things that scares me is the use of fluconazole to treat breast thrush in these very early days when the baby's liver and kidneys aren't working properly, because the half-life in a neonate is 72 hours. In an adult, it's around 24 hours. But if it's that long in the baby, can you see how quickly that level goes up? And I've seen so many babies who are vomiting profusely and about to be admitted to hospital. I can't think that it relates to any of the migraine drugs, but this is just something to bear in mind because I'm making you all into professionals to understand how drugs get into breast milk. Lots of mums try to time their drugs so that the least amount of drug is present. And that can be very important to them if they've got something like sertraline, which is for anxiety. And it might also be given for migraines if migraines are triggered by anxiety. But if you've taken any drug for 5 consecutive days, then the drug has reached a steady state. And trying to time feeds to minimize the amount of drug that gets through is absolutely pointless. Just carry on and breastfeed as normal. So drugs which are highly bound to these proteins in your bloodstream are unable to transfer into breast milk. And ideally, we want drugs which are bound by more than 90%. But this data isn't available in the average textbook that's available in a doctor's surgery. It's only in specific textbooks or on online databases. So if you think about these poor professionals, including me years ago when I knew nothing about this, what you have is the BNF, which says the manufacturer says avoid this drug in breastfeeding. So you think, well, they must have some data on file that I don't know about. This must be a very dangerous drug. I might get sued. It might harm the baby. And then they say, no, you can't have it unless you're stop breastfeeding. And the relative infant dose is a very complicated calculation. Again, not in standard UK books, but it's in mine. And it's a ratio that we want of less than 10%. So we look at the dose that would be given to an infant and we compare it to the amount that's getting through from the mother's milk. And if we want it to be less than 10%. Don't worry about the technicalities. Just remember that number. So if we're looking for treatments of migraines, standard first line is usually paracetamol and ibuprofen. I hope you would see that that's normal. Both of those are completely compatible because ibuprofen is 99 point something plasma protein bound, more than 99% plasma protein bound. So little can get into breast milk. So that's absolutely fine. Come back to all of the others, but the standard treatments are then aspirin, triptans, opioids, antiemetics, and over-the-counter drugs. So if you're going to treat your migraine, you probably need full doses, and you could take naproxen and diclofenac as alternatives to ibuprofen. Sometimes taking something to stop you feeling sick helps you to absorb the drug more effectively. Years ago, I was told that when you have a migraine, your blood system is moving away to return your blood pressure to normal, because when you have a migraine, your blood pressure actually drops. And therefore, any drug that you're taking isn't absorbed as well as it is normally. So by giving something that stops you feeling sick, it may actually help the absorption as well. So there are a variety of drugs, and very simply, things available over the counter, travel sickness tablets available over the counter, or Bucostem, which is made for dizziness, or cyclizine, which is in a travel sickness tablets. All of these will help standard painkillers to be absorbed and be more effective. We know that a single dose of 900 milligrams of aspirin is actually effective for breastfeeding, and sometimes it's used when nothing else works. Aspirin, when I had my eldest daughter 44 years ago, was the standard drug we gave to them when they were teething or they had colds or anything. We had these little tiny 75 milligram tablets. But there was a spate of cases where children had viral infections and had been given aspirin and developed something called Ray's syndrome. So they took aspirin away, didn't give it to children anymore, and we gave them paracetamol, Calpol, and ibuprofen. But there is actually no link shown between the amount of aspirin passing through breast milk and Ray's syndrome. There are no cases that I'm aware of. It's probably a drug of last resort because it can be quite harsh on your stomach. And if you can possibly wait 2 to 3 hours, if that fits in, if you've got a toddler who can avoid feeding for that length of time, then even less is there. But if it works for you, it's possible, but only if nothing else is available. There are lots of opioid strong painkillers which are available in the over-the-counter drugs in combinations. We no longer give codeine to breastfeeding mothers because in Canada, I guess it's about 10 years ago now, a mum had a cesarean section and she was prescribed high-dose cocodamol for her pain. She kept going back to the baby's pediatrician saying the baby is incredibly sleepy and this drug is making me really constipated. Can I have something different? And the pediatrician lowered her dose, but said, I think the problem is the baby's not breastfeeding properly. Go and see a lactation consultant, sort the breastfeeding out. The baby died after 14 days. And it was shown that the baby had far more morphine, the metabolite of codeine, in its bloodstream than could be explained by the amount of codeine that she'd taken. Because some people concentrate the drug in their breast milk. Excuse me. This is almost invariably people who will do anything to avoid taking codeine because it gives them such terrible constipation and makes them feel sick and dizzy. So if you don't like taking codeine, then this is probably where you're sitting. Dihydrocodeine is a much safer drug, and it's available in an over-counter drug called Paramol, which is paracetamol and dihydrocodeine. And it's metabolized in a different way, and it isn't controlled by the amount of the mother's metabolism. But most of the common over-the-counter combination drugs like Migrelief contain codeine. So something we need to be careful of. The buplazine is there to help the nausea as well. So maybe you can make your own by taking paracetamol, dihydrocodeine, and an anti-sickness drug, which is probably going to end up cheaper than the Migrelief combination. If we're looking at the triptans, the leaflet in the Immigrant box says do not breastfeed for 12 hours. But actually the drug is poorly bioavailable. It's not well absorbed from the gut. And that's why originally nasal sprays and injections were brought out, and the tablets were only brought out much later. So the actual amount of sumatriptan that gets to the baby is less than 1% of the mother's dose. So there is no reason why you can't take sumatriptan in whichever form works for you and continue to breastfeed as normal. We don't have any data at all on any of the other triptans. And that's really difficult because we might assume that all the drugs in this family work in the same way, but they all have slightly different pharmacokinetics. And I can't prove that any of them are compatible with breastfeeding. So if possible, use sumatriptan, or I know that mothers with older babies have taken things like zolmitriptan, Maxalt wafers, and have fed and not noticed anything in their babies. But that's anecdote, and that's very difficult. You know, how do you trust somebody else's experience? It's hard. Now, if sumatriptan would just help for now, that would be the better option. So the other over-counter remedies, Migraleave, Sildol, Solpadeine, Nurofen migraine, and Nurofen tension headache, all have codeine in them. Sudafed congestion and headache relief also has a decongestant in it, which can reduce your milk supply. And the idea is that by reducing the pressure in your nasal passages, it may help your migraine. But then we've got these simple remedies like the migraine pads and sheets and quick strip, which some people find really, really effective, and they would all be fine in breastfeeding. There are two very new drugs out on the market. And Rimegivant is indicated for adults who've had at least 4 migraines per month, but less than 15. So does that come into migraine overuse headache? Might do. And it's taken as a wafer, which dissolves under the tongue, and it's supposed to stop the release of a protein around the brain that's responsible for the severe pain. And NICE in May 23 said it was as an option in adults who had tried 3 previous preventative treatments. There had been very little information until I heard this week about one study where there were 12 breastfeeding women, 18 to 40 years old, who provided breast milk and plasma samples over a 36-hour period. And we were able to discover what the pharmacokinetics were. And it looks as if it is a drug compatible with breastfeeding if you hit all the other criteria. And the relative infant dose would be 0.51%. Remember I said 5% was the cutoff period. And I've put underneath here the study that relates to. It is brand new. We don't have any experience. I've not come across anybody who's used it. Fremanezumab, otherwise known as Ajovy, I copied exactly what it says that it does. I do not understand one word of it. I am not a biochemist that can explain that to you. But again, it's recommended for people who have 4 or more migraine treatments of months and for whom 3 preventative treatments have failed. But it's very, very expensive. But NICE have made a commercial agreement with the company who manufactures it to provide it on a reduced price basis, but it has to be provided directly by the company. The evidence says that we're not sure that it works any better than botulinum toxin A, Botox. But it has this very high molecular weight. So it's assumed that the baby is not going to be able to absorb it from its stomach. It's too big and it won't get into breast milk. So look now at the things that we can use to prevent migraines, because we'd all rather not have them at all. And they usually come into the following categories. So beta blockers, tricyclic antidepressants, topiramate, pizotifen, Botox, some supplements, including riboflavin, magnesium, and coenzyme Q10. Propanol is used to lower blood pressure, but it's also used to treat high thyroid and prevent panic attacks, but it's also very, very effective in preventing migraines. And this is probably the drug that is used most frequently as a preventative drug. The amount that gets through in breast milk, even at 40 milligrams 4 times a day, it's a very high dose, would be micrograms, minuscule amounts in 24 hours. And no babies have had any reports of adverse events, partly because the liver metabolizes most of it before it even gets into the bloodstream. So very, very low levels there. It's probably one of the safest drugs that I recommend for any condition. Amitriptyline was originally prescribed for depression, but it's also used for chronic pain It's not a painkiller, but it alters the perception of pain in your brain. And a group of 20 mothers who were breastfeeding were followed for 3 years at varying doses. And they discovered that there were no adverse effects on the growth or development, and the amount in breast milk was too small to be harmful. But it may well make you very drowsy. So if you have a small baby with whom you are co-sleeping, you need to be very careful, because if you're drowsy, then you have the risk of rolling over onto the baby. If your baby is 2 or 3, it's going to be quite capable of elbowing you in the ribs and saying, "Get off, mum," or rolling into its own space. But if it's a tiny one, then maybe you need to have sit alongside cot or something that the baby is in, or your partner, baby sleeps with your partner on the other side of the bed. Topiramate is quite frequently used to control epilepsy, but at higher doses than those usually prescribed to prevent migraines. A study in 2006 showed that 6% of people who took it became migraine-free. The recommendation is that they should monitor the babies for drowsiness, diarrhea, and adequate weight gain, because can you see the relative infant dose is much, much higher, up to 56%. So this is one that we're much more wary of. Probably we'd be looking at an older child who was feeding less frequently. So again, the total amount of milk being consumed was lower than if it was tiny. Botox seems to be frequently used by mums. I've seen it being given as a 6-week celebration post-birth to remove those lines that you developed after birth. But this is about medicinal Botox. There are no actual studies, but there is one case where a baby was exposed to botulinum toxin via its mother's milk. The mother ate toxic salmon that comes to my mind, and developed botulinum toxin, but they couldn't find it in the mother's milk or in the infant. Now, again, it's probably because it's such a large molecule that it wasn't passing through. The doses that we use medicinally are far lower than would cause botulism, so we don't think that the infant would be ingest a significant amount as well, and it's still this large molecule. So if Botox works for you, there is no reason why you can't have it when you're breastfeeding. There are 3 supplements that I have found being recommended more recently. High-dose riboflavin, it's been proposed for migraine prophylaxis. The evidence is a bit controversial. There's no actual studies about the amount getting through in breast milk, but there's no toxic dose of this vitamin. So it seems to be okay. One mother said it produced yellow urine in her baby, as well as herself. I'll present it here for completion. So one placebo trial of 80 patients suggested that 220 milligrams of zinc reduced the headache severity in migraine sufferers. The duration of attacks and headache daily results were not altered, however, but it's not going to be harmful. And for some people, magnesium has been shown to be effective. A lot of people use magnesium for their premenstrual headaches, because often they will report things like having excessive breast tenderness or mood changes just before their periods. So it's something that goes across the social media sites. Have you tried magnesium? And there's some limited evidence that coenzyme Q10 may be effective, but we have very, very little research. It's really difficult to get research on any drug used in breastfeeding because nobody wants to fund it. The manufacturers aren't going to because they're not required to, and nobody else has the capital. So this is one story. I managed to secure Botox injections after other medications didn't work. I had to argue my case with my neurology team and give them time to check it out. And they all agreed with me. The consultant still wanted her to pump and dump for 24 hours afterwards, just in case. Now, when you're told to pump and dump, you have to be a breastfeeding mother to know how completely devastating it is to throw away milk that you have made and hopefully use stuff that you have in the freezer. Your baby may not take a bottle. Not all babies do. You may not have a supply. You may not react well to a breast pump or be much longer down your journey and not be able to pump. She was one of these people who's taken rizatriptan because sumatriptan wasn't effective for her. One occasion when she'd run out of a rizatriptan, she was told to take high-dose aspirin. But she was now tandem feeding a 2-year-old and a 5-month-old, still on the injections. She actually told me this story during the COVID pandemic, and she wasn't sure about whether she would be able to get her next treatment because face-to-face treatments were not being permitted. And her cry was, I don't know when I'll be able to function properly again. And she's got these 2 young children that she's got to care for and deal with. And kind of stories that break my heart and why I still do this and still don't want to retire. So, as a health professional myself, or if you see a health professional, you may be told you can't take a drug if you're breastfeeding. There are so many things health professionals have to know. And if they haven't found a reason to learn about the way drugs get into breast milk, this may be a total black art to them. You might get different people telling you different things. You may feel very strongly that you and your nursling aren't ready to stop. And if you email me or the Breastfeeding Network team, we'll all be using the same sources of information. But it's important that actually the conversation doesn't go around to, why are you still breastfeeding a 3-year-old? That's your decision. It has nothing whatsoever to do with treating your symptoms. Breastfeeding has positive health benefits for you and your baby, not just immediately, but throughout life. And your breast milk does not lose value after a particular period. They have analysed it, and at 5 and 6 years, it still has the same antibody passage that it did at 5 and 6 weeks. It doesn't stop being magic. So just remember and be kind to professionals who are doing their very best, because they're left with this hard problem where the manufacturers aren't taking responsibility. They've got to take the onus of prescribing when they may never have been taught anything about this. And the person you see may have actually formula fed their own child. Maybe they failed at breastfeeding and then have a negative view of it. But there are usually drugs which you can take in breastfeeding on. And I think it's really important that every mother and her partner are involved in the decision on what you take and whether you breastfeed or not, and that your decision to breastfeed should be being respected. I've presented quite a few, or put quite a few of these talks now on a YouTube page, and you're very kindly allowing me to put this up onto there as well, so that all of these things will be in one place for professionals to go to do their own CPD. These are the specialist sources of information that I use. LactMed is free to access. UK Dialysis is part of the UK Medicines Information Authority. I'm assuming you have access to that. Hale has a beautiful big book, or you can get it online. But I've tried to make a lot of the fact sheets available to do the research that other people don't have time to do. And for professionals, in trying to do no harm, we can cause harm. by telling a mum to interrupt breastfeeding. She may develop mastitis if she can't express enough. The baby may refuse to feed. The baby may be intolerant of the formula. Mum may not be able to afford the formula. And if her milk supply starts to drop, it can be difficult to re-stimulate. It doesn't turn on and off like a tap. So, takeaway message is we can use evidence-based sources to check the safety of drugs to treat migraines and to prevent migraines and relieve other symptoms. And I hope this presentation will allow you to share this with other people that you come into contact with. And if you have a question, I'm always more than willing to answer it for you. If you have any questions we don't get time to get to at the end of the day, please do email me, and I'm going to make a copy of the slides available for you to see at the end of this. So thank you.